So the post-op care is usually the hardest part for most owners. We're all so worried about the surgery itself. All of our planning and thoughts stop at the day of the surgery.
Welcome to Dog Cancer Answers, where we help you help your dog with cancer.
Hello. I'm Molly Jacobson, editor-in-chief at dogcancer.com, where over 40 veterinarians, veterinary oncologists, licensed veterinary technicians, cancer researchers, and science writers like me pull together to bring you the best information about dog cancer, better information today, so you have no regrets tomorrow. This is the third video in our three-part surgery video. In the first and second videos, you will find out how to prepare for surgery and also how to take care of your dog on the day of surgery. But in today's video, we're going to focus on the critical hours, days, and weeks after surgery, when you've got this groggy dog and you need to know how to take care of them. To give you the best tips and advice, our host James Jacobson brings back Kate Basedow, who has been caring for dogs, cats, ducks, horses, ponies, all sorts of animals on her mother's farm. Her mother also happens to be a veterinarian. She's got a lot of tips and advice up her sleeve. Which reminds me, if you do find this helpful, please feed the algorithm, like, subscribe, and comment so that future dog lovers find this information when they need it for their dog. And now let's get to the conversation with Kate Basedow.
Hello, friend, and thank you for joining us today. Today, we are going to take a deep dive into how to ensure the best outcome for your dog's cancer surgery after your dog had surgery, post-op surgery. And joining us is Kate Basedow, who is our associate producer and also a licensed veterinary technician. Hello, Kate.
Hello, I'm happy to be here.
So this is part of this three-part series we did before surgery, the day of surgery, and now this is after surgery. What are some of the tips that you'd recommend people follow to make sure that the surgery that you just went through is going to have the best outcome now that it's over?
So the post-op care is usually the hardest part for most owners. We're all so worried about the surgery itself and the anesthesia that all of our planning and thoughts about it stop at the day of the surgery. And so then you're handed back your dog and someone's like, oh gosh, what now?
Right.
So expect that your dog is going to be groggy and tired when they're handed back to you after surgery. Even though it's been a couple hours since they were woken up after the procedure, they're still working some of those drugs out of their system, and it may take a couple days to be completely back to normal, especially if your dog is older or has a lot of health problems that compromise their system. Usually, the veterinary staff will give you a heads up on any side effects there. So also expect that your dog may not pee or poop for a day or two. Usually they'll urinate pretty quickly the night after the surgery, definitely the next morning. Pooping might take a couple days. Anesthesia kind of makes them a little constipated, and depending on where the surgery was done and where the incision is, your dog might not be totally confident about positioning herself to defecate. So it might be a couple days. Don't panic, this is normal. If they haven't pooped by day 4 or 5 after surgery, then I would call my veterinarian. Usually they'll recommend just feeding a small meal the night after the surgery, just so that you're not hitting their GI tract with a ton of food. I wouldn't be too alarmed if they don't want to eat that same day. The next morning, they should be back to eating. If they're still kind of like, I don't know, you can try a couple different things to entice them to eat. Add a little warm water to the kibble if you feed dry food to both soften it, and the warm water will help bring out the natural aromas in the food, and the increased smell will encourage them to eat. If they're still not eating by 36 hours after the surgery, I would definitely call and check in with my vet, and they'll probably ask you other questions about how your dog is doing, how their activity level is. They may end up prescribing an appetite stimulant to try to encourage your dog to eat, or they might just say to give it another day, depending on your dog's unique case. So expect that the incision may ooze a little bit. Clear and thin or bloody discharge isn't anything to worry about. If there's a lot of discharge or it ever starts to look thick in consistency like pus, that's a concern and a potential sign of infection, or if it's bleeding a lot. Signs of infection are really red, irritated skin that feels warm to the touch. Also, any oozing or odor, or if the skin starts to look kind of black and necrotic, that's a sign of concern. If you have concerns about your dog's incision, or if it's still really oozy after 4 to 5 days, you can always take a picture and send it to your veterinarians, either to their email, or a lot of hospitals now have an office cell phone that you can send pictures to, so that a staff member can look at it and either say, yep, that looks totally fine, or, that looks a little funky, maybe bring them in, come in at such and such time, and we'll check it out more closely. If the incision ever opens up, definitely that's a concern. Some other things that can go wrong with the incision is that can sometimes, if the dog's a little too active, can develop what's called a seroma, which is a swelling. It's a pocket of fluid. It's just normal fluid that happens to pool in open spaces under the tissue where the surgery happened. Like I said, usually seromas happen when the dog's been too active. Once you've had your vet check it out and they're like, yep, this is just a seroma, it doesn't look like an infection, they will likely tell you to alternate warm and cold packs on it, 5 minutes of warm, 5 minutes of cold, a couple times a day, to encourage that fluid to get back into the circulation and get out of that pocket. Other things that can happen with the incision, there is often bruising, especially on light-colored dogs. And bruising, just like us, the bruise isn't going to show up immediately, but it'll show up a couple days after the surgery. So don't panic if you suddenly see purplish bruising. That's normal. Just means your dog has delicate skin. You can ice the area if your dog will let you, to help get any inflammation down and help with pain control.
And
Many dogs don't like that.
What do
I
you
like
use?
good old either frozen peas or a flexible ice pack. The rigid ones are a lot harder
stay in
to
the
use.
bag.
Yes.
Yeah.
And wrap it in a thin towel so that because a lot of times ice packs have that little bit of moisture on the outside, and then that can freeze, and you don't want that to freeze. A paper towel or a thin hand towel is a good way to go to help with that. So the biggest thing is restricted activity. Your veterinarian
And
is
the most difficult.
Yep, especially with young or active dogs. Incisions take time to heal. Usually the range for suture removal is usually 10 to 21 days. 10 to 14 is pretty much the standard healing time for most incisions. But if the incision's in an area where it's under a lot of pressure, like over a joint or on top of the body, they might go for the full 21 days. Short leash walks, under control only, no running, no jumping, no going out loose in the yard, no, oh, she always just goes to the bottom of the stairs and pees and then comes back. Nuh-uh. On the leash all the time when outside. No going up and down the stairs willy-nilly in the house. No rough play with the other dogs. It can be annoying, especially if your dog normally is very active, and usually within 3 or 4 days after the surgery, they're feeling pretty good and they want to do their normal things. But that incision is delicate and trying to heal.
And if you have small dogs, we've had success with playpens. Just go and you can often find them really cheap because people when they're done with their playpen, they're done with their playpen.
Oh yeah, and for the tiny dogs, you can even use like the fabric, easily collapsible playpens that are light and cheap and easy to move around, and they're usually in cute colors too. The restricted activity is the big thing. A lot of time clients will say like, oh, I just let him out to pee in the morning. He never does anything. All it takes is one squirrel. Just don't take the risk, because as annoying as it is to keep them quiet and to leash walk them when you're used to letting them run loose in the yard on their own, it's way more annoying to have to bring them back in and pay for a second surgery to repair the first one. If your dog's really crazy, your veterinarian may be able to prescribe a sedative to help take the edge off for the initial healing period. Most dogs don't usually need that, but you never know. And it's a nice thing to have as a backup if you've got kind of a crazy wild dog. Other things to watch for after surgery is vomiting or persistent diarrhea. Sometimes once they do finally do that first poop after their surgery, they'll have loose stool for a couple days, either due to the anesthesia or if they're not tolerating their pain medications. If you ever have any concerns, just give your vet a call and they can talk you through what to do or not do. And then once you're through that initial healing period, don't skip your suture removal appointment. It's important to get those out.
Get those out. Don't let them assume that they're going to naturally disappear, because they do. Some of the suture material does, but it actually is helpful to make sure everything is out.
Yeah, there are absorbable sutures, and some surgeons will close the incision in such a way that all of the suture material is under the skin, and then they might put tissue glue over the top. So those dogs would not need to come back for a suture removal appointment. Usually, if a dog has cancer and is having a tumor removed, they're going to do a higher powered suture material that will require removal. And definitely if the dog has staples, those will need to be removed in the hospital. So if you're unsure how that suture removal appointment's going to look, definitely ask your veterinarian ahead of time. Sometimes if the surgery involved a leg, there might be some additional rules about easing back into regular activity. But for the most part, once the sutures are out, it's game on. Have fun. Do what you want.
Well, Kate, this is wonderful. I appreciate your all these tips, what to look for in your dog's poop, to everything. Thank you so much for joining us on Dog Cancer Answers.
Make sure to check the video description for links you don't want to miss. And I really sincerely hope from all of us at dogcancer.com that as your dog heals from surgery, they heal well and completely recover. Subscribe to our channel so you never miss an episode, and I'll see you at dogcancer.com. See you later.
Thank you for listening to Dog Cancer Answers. If you'd like to connect, please visit our website at dogcancer.com or call our listener line at 808-868-3200. And here's a friendly reminder that you probably already know. This podcast is provided for informational and educational purposes only. It's not meant to take the place of the advice you receive from your dog's veterinarian. Only veterinarians who examine your dog can give you veterinary advice or diagnose your dog's medical condition. Your reliance on the information you hear on this podcast is solely at your own risk. If your dog has a specific health problem, contact your veterinarian. Also, please keep in mind that veterinary information can change rapidly. Therefore, some information may be out of date. Dog Cancer Answers is a presentation of Maui Media in association with Dog Podcast Network.